From the PEP Radio Newsroom, this is the latest news blast for this hour. LGBTQ Nation is reporting that while Senate Republicans recently took steps to restore $400 million in proposed funding cuts to the president's emergency program for AIDS relief, or PEPFAR, a global HIV prevention program estimated to have saved 26 million lives in developing countries since its 2003 launch, the Trump administration's State Department has drafted a plan to end PEPFAR. The plan would replace PEPFAR with a for-profit program to detect HIV outbreaks in low-income countries and then sell them American medicines and services, the New York Times reported. Draft documents viewed by the aforementioned publication seek to end PEPFAR within 2 years. The plan would implement Secretary of State Marco Rubio's desired 42% reduction in PEPFAR's current budget of $4.7 billion, amounting to a $1.9 billion reduction. PEPFAR would be replaced with a system to rapidly detect and respond to disease outbreaks in poor countries using bilateral relationships between the affected regions and American companies that would then sell medical products and services. We believe that the transition of PEPFAR can become the premier example of the U.S. commitment to prioritizing trade over aid, opportunity over dependency, and investment over assistance, the draft document states. Though the plan's details have been in development over several weeks, have received comments from senior State Department officials, and have already been shared with PEPFAR partners in other countries, a State Department spokeswoman said the documents hadn't been finalized by department leadership and don't reflect the State Department's current PEPFAR policy. Despite PEPFAR's past success, the president and congressional Republicans have repeatedly targeted the program, with some social conservatives claiming that PEPFAR funds are used to promote LGBTQ plus rights. On January 20th, the president issued an executive order calling for a 90-day review to reevaluate and realign all U.S. foreign aid policies and programs. Shortly after, he ordered the shutdown of the United States Agency for International Development, or USAID, including its work on PEPFAR. Amidst widespread criticism, the administration offered a waiver allowing some PEPFAR programs to continue. However, those waivers haven't been issued to any HIV prevention programs that support HIV-positive men, sex workers, and LGBTQ plus people most at risk of contracting the virus. Instead, the current administration only supports programs to counsel, treat, and provide condom and pre-exposure prophylactics, or PrEP, to childbearing women. While the White House's original budget proposal for the coming years had sought to severely reduce all PEPFAR funding, the administration agreed to an amendment to the budget bill that would exempt the HIV/AIDS relief program. Nevertheless, the aforementioned alterations to PEPFAR's provision may result in over 11 million additional HIV infections and 3 million additional AIDS-related deaths across Sub-Saharan Africa by 2030, according to out gay Representative Robert Garcia, a Democrat from California, who recently wrote in a letter to the U.S. Secretary of Health. Garcia's letter demanded information about the administration's shameful and widespread elimination of HIV and AIDS-related research, vaccines, and life-saving programs, questioning whether their elimination was rooted in science or in misinformation and disinformation. I would add to that bigotry. Experts worry that HIV infection rates are rising in the African countries most affected by HIV as preventative medications run out across Africa. There may not even be a clear way to measure the damage caused by the funding cuts because those cuts have also ended data collection efforts to track the virus's local prevalence. That's the News Blast at this hour. Download the Live 365 app to take PEP Radio with you wherever you go. Up next, we have the Meadville area weather forecast here on PEP Radio.